If the pursuit of happiness is the basic right, good health arguably is essential to happiness. For the poor, good health is often illusory and expensive when management is viewed employees as disposable tools. Coal miners had to struggle to get health benefits, and one knows the history of urban factory workers and sweatshops of the early 20th century. Health care for the poor, added to an expanded and upgraded VA system, is the better approach. If good health is a basic human requirement for happiness, global sweatshop management often viewed it as a costly externality. The president, in being more concerned for coddling a prosperous middle class with expensive and perhaps unrealistic promises of cheap insurance, neglected to structure a practical health care system for the poor. The plutocracy agenda benefited. Why do war and taxes exist? The U.S. government has no constitutional requirements for spending anything at all. It was the need for producing salt and bonuses to private producers to do so early in the nation's history, and later Abraham Lincoln's need to pay for the Civil War that required taxes and income taxes. In either case, the private sector might have funded their own Civil War without government help if they had allowed mercenary plundering of the South, obviously an undesirable practice. With mercenary plunder and booty available in southern banks and mansions, innovative new methods of war might have developed. It would have forestalled the need for a new standing army and onerous government spending required for that, with taxes on the citizens. Insurance for the rich and middle class is really a separate issue than that of the poor using Medicare. Medicare is something of a mystery to the hypothetical working poor users of Obamacare getting fewer than $15,000 annually in earned income, where the divide for Medicare and insurance exchanges lay. Citizenship in the United States should benefit from effective, cost-efficient government and job security within an ecologically recovering environment, not adulterated by a plethora of globalist corruptions. A quality reformation of capitalism, capping corporate size at 5,000 employees and limiting the number of corporations anyone can own stock in at 3, might be able to stimulate competition and break up further development of plutonymy and networking, if financed by insider traders of the 1%. A human rather than a sociopathically cold-blooded organism approach to economics managed by and for elites is better. What is interesting is the idea that federal government workers will be using the new health exchanges too, instead of the existing insider federal insurance program. It will be a matter of time, I suppose, before Walmart and Exxon start selling insurance on exchanges too, in order to catch some of the torrent of cash trickling upward or flowing upward to the global plutonymy of the 1/10 of 1%.